Hey, this is Dr. Dan Purser here. What do I look for when I look through a genetic panel? These are things that will kill you if you don't find them, or could kill you. The first is homocysteine. You have a genetic reason to have a high fixed homocysteine. So I dig into all the methylation stuff. I'm looking at MTRR, MTR, the MTHFRs. They block the breakdown of homocysteine to glutathione. Matter of fact, this is all about the transformation of homocysteine to glutathione. If you're homozygous on any of those, you're going to have a high fixed homocysteine level. So we got to deal with that. We deal with that using the virus glutathione because the glutathione in there actually works. So it actually lowers interleukin 8 and MCP1. What you really want to follow, you can't change your homocysteine even with the glutathione. It's stuck. But what it causes is a release of two cytokines, the main one being interleukin 8, IL-8. It lowers that down to 0 when you take enough of it. So you can follow that or have your doctor follow that for you. The next thing I look for is PEMT. PEMT, if you're homozygous, means you can't make enough phosphatidylcholine. It can cause you to have NAFLD or fatty liver disease, causes a NASH then, which is non-alcoholic steatohepatitis, which means your liver is dying and getting really scarred up, and then your liver dies. So you either get a transplant, you die, or you get liver cancer. Those kind of all go together. So that's the second thing I look for. What's the third thing? NR3C1. It's going to cause brain inflammation and shrinkage and dementia. You can't make phosphatidylserine. So remember, PEMT, you can't make phosphatidylcholine. NR3C1, you can't make phosphatidylserine for your brain. There's also a lot of crossover between those. The phosphatidylserine can definitely help your liver, and the phosphatidylcholine can definitely help your brain. The fourth thing I look for is SOD errors. SOD1 can cause ALS or Lou Gehrig's disease if you're missing it. SOD2 can cause cancer, and SOD3 causes all the other inflammation in your body, except for that caused by homocysteine. So if someone has SOD3 and homocysteine, they have a lot of inflammation. They're going to be hurting. So we usually add the VARS SOD, which also meets our VARS standard. VARS SOD capsules are amazing, and they can bring down the inflammation. You'll feel it. Just like you'll feel it when your IL-8 drops to normal or 0 when you're taking the glutathione. Anyway, that's just my thoughts, but I just want to get that out there because I keep talking to patients about all this. So thanks much for watching. It's Dr. Dan Purser.